Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hey everybody, this is Kelsey here for another episode of Business Ninjas. I'm here today with Banu. He's the founder and CEO at HBox. Banu, welcome to the show.
It's great to be here, Kelsey.
Fantastic.
Nice to talk to you.
Absolutely. So, Banu, tell me a little bit about yourself.
Yeah, great. So I'm originally born in India, trained engineer, worked for multinational corporations like Nokia for a long period of time, and then started my entrepreneurial journey in 2012 with a health tech startup called FitTrax, and raised a couple of rounds of funding, ran the company from 2012 to 17, had an exit, and then now this is my second entrepreneurial venture with a company called HBox, again in the health tech space. And we were born in the middle of the pandemic, so it's kind of I think one thing that you can say about pandemic is that it woke up the world for application of technology in healthcare. And since I was in the space from 2012, and there was regulatory framework changes in US that accelerated the adoption of tech, and hence HBox was born.
Very interesting. So what exactly does HBox do?
Great. So what we do is what I call the motto of our company is create a virtual clinic inside a clinic. So we work with outpatient clinics of all sizes throughout the nation. Right now we are operating in 9 states in US. And what we do is we work with these clinics, clinics meaning outpatient practices, where we enable their practices to provide for their patients virtual care services. Virtual care services, generally people think it's kind of a telehealth and video visits. But what we do is much more deeper. So we enable these practices and physicians to connect with their patients to take care of like chronic care, which is what I call as longitudinal care, as well as the episodic care with beyond just video consultation through AI and other technologies to get connected with the clinic. So essentially, we enable these clinics to provide these services. But the good news is most of these services are now reimbursable from Medicare. So in return, what we do is we generate a significant new revenue opportunities for these clinics. And so that's the great thing, what we do. So we just don't provide the service, we generate revenue, and they don't need to invest on technology or new set of people. We come with technology, and we also provide healthcare professionals for these clinics to provide these care services. So it's kind of a turnkey end-to-end solution for practices to provide those care services, in turn able to get a reimbursement from Medicare and other commercial payers.
Okay, very interesting. So how does HBox specifically generate revenue then for your company?
Sure. So what we do is as I said, once we sign up a clinic, a practice, the practice can be of one physician to we have customers with 30 physicians as well. So the practices vary of various sizes. So what we essentially do is when we work with them, we invest on behalf of the clinic on providing medical devices and so on to their patients. And then we also enable these clinics to provide clinical staffs who know technology and interact with the patients remotely. And the third critical element is we bill these clinics to Medicare and other commercial on behalf of them. So we do the end-to-end, and then what we do is we generate invoice for these clinics once the reimbursement comes through. And so our revenue stream is basically per patient per month we charge a fee to the clinics. And
Okay.
these fees are invoiced only after the reimbursement happens to these clinics. So in effect, the clinics
Mm-hmm.
have a zero risk
Mm-hmm.
uh, model.
Okay. Okay. It sounds like you are targeting a few different audiences because you have such a wide range of reach. Right now, you're in 9 states. You've got, clinics with 1 to 30 physicians. What is really the sweet spot for you and who you look to target with HBox?
So we work with, there are two elements, right? One is we work with clinics or practices which
Mm-hmm.
are predominantly have Medicare patients, because I
Mm-hmm.
think this is where it has the maximum clinical impact to the patients as well.
Mm-hmm. Mm-hmm.
And then the other element is we work with different types of practices. So they can
Mm-hmm.
be primary care or they can be specialty practices. Like our biggest customer base is in pulmonology, cardiology, and nephrology.
Okay.
And so we work with the two dimensions is we try to target those practices who have large number of Medicare patients they
Mm-hmm.
serve. And then the
Mm-hmm.
second one, typically they are specialty clinics like, as I said, pulmonology, nephrology, and
Okay.
cardiology.
And what would you say the challenges are that these clinics face that really puts HBox at the forefront of what they're looking for?
Sure. So there are two elements of it. One thing is, as I said, the one, if at all there is any silver lining of pandemic, is it
Mm-hmm.
woke up the whole nation, starting
Mm-hmm.
from the government to the patient,
Mm-hmm.
consumers, to the physicians, that technology is the way to move forward.
Mm-hmm.
Having said that, it's a different thing to deliver a virtual care services from
Mm-hmm.
these clinics' perspective. They are experts on delivering care in a
Mm-hmm.
physical face-to-face setting.
Mm-hmm.
But to deliver, monitor the care in a virtual care setting is
Mm-hmm.
totally different. You can imagine this as what happened in early 2000 when retail went digital, right?
Mm-hmm.
People thought it's as simple as putting a website for retailers to sell online. But
Mm-hmm.
they learned it in a hard way. It's not just about putting a website. There is a whole new way of operating the business.
Mm-hmm. Mm-hmm.
And that is something the practices are realizing. It's not
Mm-hmm.
just about buying the hardware and software from any company, but it's also business practices and how do you care deliver in a
Mm-hmm.
virtual setting is altogether a
Mm-hmm.
new way of doing business, so
Mm-hmm.
to say. And
Mm-hmm.
that is where we come in. And we just don't provide hardware, software, but we also provide, as I said, the workflow, the processes, integration, billing, the whole thing. We
Wow.
run the virtual clinic for those clinics. So that's the first
Wow.
element of it. That's the challenge we solve. So it's
Mm-hmm.
not, it's almost overnight. They need to start building a new competence of delivering virtual care, and that's not easy.
Mm-hmm.
And that's where we come in. That's one element of the challenge that we help them and to solve. The second
Mm-hmm.
element, equally important, is most of the physicians realized during the pandemic that their revenue stream is so tied to patients visiting physically in the clinic.
Mm-hmm.
And if you don't, then it's essentially there's a huge revenue drop for them.
Yeah.
And what this opportunity provides is it's kind of a consistent monthly reimbursement that Medicare provides, because
Okay.
what Medicare is looking for is enable long-term savings for chronic care patients. So they are willing to
Mm-hmm.
provide on a monthly basis these kind of cares for
Mm-hmm.
which they reimburse. So which also means that creates a continuous monthly recurring revenue
Yeah.
for the clinics. And
Yeah.
that's two things: new revenue streams, which are of monthly recurring, which they never had before. And then the second, our approach of providing turnkey solution. They don't need to hire new
Mm-hmm.
clinical staff with new skill set or invest on
Mm-hmm.
hardware, software, and the whole nine yards are
Right.
the two reasons why they are embracing our solution.
So how do you work to educate who you're reaching out to with those new clinics? How do you reach them to educate about HBox? Talk to me a little bit about that.
Sure. So it's a very new emerging field. To give you the size of the market, it's kind of there are close to 48 million Medicare patients whom our services can be prescribed, and Medicare would reimburse that. And those 48 million Medicare patients are served through close to 1,200 clinics or practices nationwide. So it's a huge market. Less than 1% of that market is actually penetrated as of today. And this is a whole new market that literally got created in the middle of the pandemic.
Okay, interesting.
And that's kind of the broader setting in which we operate. And it also means there is a whole lot of competitors and new players addressing the same market. And we, as I said, we have our unique approach of doing end-to-end and so on. Having said that, to answer your question, how do we reach out to the customers per se? The good thing for us has been we have zero sales team. So what we started off with, our first customer, we enrolled and went live in March of 2021. Late March of 2021, and that was through organic contacting few of the people from my network in the previous company, previous venture, and so on. And then we onboarded couple more clinics through the referral from the first clinic. And then we try to figure out the entire process. That's where we spent bulk of the 6 months till August, September of last year. Then what happened is we started getting referrals from those 4 clinics whom we onboarded. And once they start seeing how the system works and they got reimbursement and so on, they started referring us to other practices in their network, because this is kind of, from quote their words, is a no-brainer kind of a model, and hence they started referring us. And luckily for us, that is how the network keep growing. And it's amazing how we grow from 1 state, 1 clinic to now close to 9 states. We have 100 practitioners as our customers. And all this has happened in the span of, I would say, 6 to 8 months through referral programs that they actually existing customers. And what I learned is during this process, one of the toughest thing to do in healthcare industry is to sell any value to the physicians. Because of the nature of the industry it is very tough to convince a physician to prescribe new things. And where it helped us is if a physician recommends to another physician and says it has worked for me, so you should take it out, that drastically not only reduces our sales cycle time, but our chances of getting them on board increases drastically. And that's so far, I would say that has been predominantly our go-to-market strategy, which is existing customers referring us. And our sales pipeline also is great because of that. As we add more clinics, they refer more clinics. Once they start getting the program working for them, they get excited and refer us to others. That's how we predominantly have grown so far.
Well, Banu, this has been a fantastic conversation. I love your approach, your go-to-market approach of the word-of-mouth marketing. And it sounds like it's been done numbers for your business for talking about comprehensive virtual care for HBox. Again, Banu, he's the founder and CEO at HBox. Thanks for being on Business Ninjas today.
Perfect. Thanks a lot. It was a pleasure talking to you.